The medical equipment that we brought here, some of you can already see we are receiving deliveries from KEMSA, all in preparation for any eventuality. And we want to say as a county we are prepared, we think and we believe we are well prepared in the event of any outbreak or any suspected case. And so we would want to reach out to our people and number one, appreciate that the people of Nyeri are truly taking this matter seriously. We have seen in the bus stages, we have seen in our offices, we have seen in public places that we have all agreed to disinfect ourselves, to sanitize our hands and to avoid the greetings. We have also, we must also alert that today, between today and tomorrow, schools will be closing. And so we expect an increase in pedestrian traffic. We would want to request that the SACCOs continue being on high alert. Let them provide the necessary sanitizers. And basically, we are saying, we know we have heard there is a shortage of sanitizer. Soap and water will also do. So unless you have any questions, maybe.
We would want to know, are these part of the sanitizers, Mr. Governor?
Yeah, I think part of it is disinfectants. We also have sanitizers in stock, and I think some other medical equipment. Medical provisions. I may not have checked properly, but I think that is what we have.
Yeah, Governor, for clarity,
yes.
Perhaps, what for a patient who is not aware, or someone who is or is infected with coronavirus, who meets the costs of the treatment, if at all we have such cases, both in the county and if at all there's any communication from the national government?
I think now, if I may speak for Nyeri, we are still running a UHC mode, and so all treatment to people under UHC is given free as we speak now. So anybody within the county who is registered with universal health care, health coverage, we will be able to foot the bill. Normally what we have done with other people from other counties is that we have cost shared. And I think we will use the same mode and method.
Governor,
yes.
Apart from the Mount Kenya Hospital,
yeah.
Another facility, be it private or public, that you are maybe partnering with?
Yes, the Outspan Hospital also have an isolation ward. We are encouraging Tomotomo and Madari to also have the same. I think it's better to be prepared than to be sorry. I think we want to urge all the people, all the facilities, let us be prepared. Let us be prepared. Let's ward off any eventuality. And I would rather we spoke about having been prepared and not had a case than having a case and be found with our pants down. I think that would be a tragedy for all of us. Yes.
Maybe, okay.
Yeah.
Maybe does the county have any plans to reduce visits in wards per day?
Oh yes. What we are saying is that this is, I think, a standard. We are saying that hospitals should limit the number of patients that are visiting the number of visitors that are In fact, our recommendation would be that we leave it to the bare minimum and to close family relatives who have been identified, so that we stop flocking into these hospitals. That is also another crowd that we are going to create, and we will also be increasing the risk of infection. Yes.
Maybe for nurses
or
medical practitioners,
do
you have enough protective gear, and again, will they be tested regularly for this virus?
You see, we will only test when people exhibit signs, because really corona is a viral disease. It will appear like a normal cold. And until now, we have issues of temperature, the dryness, the runny nose, weakness. That is when we suspect. Like yesterday, we had such a scare in Nyeri because we had a patient in Mukurweini who exhibited such kind of symptoms, and every effort was made to find out what was happening. And when he was tested, he was found to have severe malaria. He had just been to Kisumu, I think, 2 weeks ago. But what was worrying most was when he mentioned that he had worked for a Chinese company, and everybody got into a panic mode. But so far, He is undergoing treatment. He is doing well. The temperatures have come down as of this morning, and he is responding well to treatment, although we are still awaiting the results from the blood samples we sent. You know, as we are speaking and we are asking national government and MOH, it is now important that we devolve the testing, laboratory testing services for this problem right into the regions, because right now we all have to send our samples to Nairobi. It's taking a little bit of time, but we would request that MOH organizes that we devolve to the regions.
Governor, last question. We've had many departments so far that have been affected.
Yes.
Especially talking about tourism. And this, of course, may in turn affect the revenue of the county.
Yes.
How has this been affected so far? How maybe do you push on this?
I think we must all be prepared that in the event, if looking at other countries, we might be headed for a total lockdown. And so it will have a devastating effect on our economy. But I still believe that economies can always be revived. But we may never bring back to life those that have died. So for us now, our focus shall be, can we ensure that our people continue living healthy and that we do not lose any individual? Issues of, definitely, you agree, when we lock down, when we close down supermarkets, when we do all that, right now I've just heard that there is a very big queue at Naivas and other places where they are trying to whittle down. Yes, I still think that let's focus on what cannot be redone. That is taking care of lives, save as many lives as we can, protect our people. We will deal with the economy later. Yes, thank you.